Thanks, Larry. It's great to be back for my annual report. And, I have to say, it is remarkable to see so many good people in one place and just to reflect on how important these sorts of partnerships are. But let me just get right down to business on the annual report. I've heard a lot about developing countries. Last year, I probably talked too long about the state of the United States, but I was just in Singapore 2 weeks ago. Their biggest problem is that the average person will live to be 85, and their average teenager today will live to be 100. And they're trying to figure out what to do with that. There I was with my United States government contingency. We're at 76 and going down. We're currently in last place among high-income countries in life expectancy. So as we focus on discovery, and I'm all for it, I want to have new things, say a little bit more about that in a minute. This needs to be the time when we focus on how we implement what we know in a way that leads to better health outcomes for the people that live in this country, because we are headed the wrong direction in a hurry, and I think this is an emergency that we need to wake up about and get really focused upon. Now, the second part of my annual report is about Larry Tabak, who I feel like last year, I think I gave like a whole long litany of his many attributes, thinking that he would be gone by now. So I won't repeat them all, other than just to say that, having been part of the HHS family and in my first term as commissioner, Larry has bailed me out a number of times. He knows everything there is to know about the bureaucracy of the federal government and how to optimize its function. And for that, I'm eternally grateful. But I think we all should be grateful for the amazing job that he's done as a stand-in. And but I think a lot of people know how excited I am. And this gets back to my first comment on the state of this country, health-wise. It's time, from the FDA perspective, I feel like this country, and everywhere I go, people say the same thing. We are the world leaders in innovation. We're the world leaders in developing new medical products. The technology we developed is awesome and has a lot to offer people. But as I said, we are at the bottom of the heap when it comes to deploying the technology that we have and the health resources that we could put into play. And I was really thrilled. I heard Monica say it in the hearing, that we're going to focus on the clinical trials arena. From the FDA perspective, that space, after products are approved and they're on the market, we don't know what to do with them right now. And we have no system that delivers systematic information that would inform a patient, a doctor, a nurse practitioner, a pharmacist, a health system administrator, or an insurer about how to choose one over the other. It's almost as if we designed a system that was intended to never answer that question, so we could just leave it to advertising and detailing as a way to get this done. And the result of that, in my opinion, is $4.3 trillion a year with the worst outcomes of any high-income country. Have I made my point? I'll stop at that. Last thing, I do want to celebrate innovation. And it's special for me, as some people know. I'll just say it. I have a younger brother who has pancreatic cancer, and so I was really excited to see that one of the awards this year is for people working in that field. And so I do have a deep sense of the urgency that we all have when we have a critical illness, and we're hoping there's some breakthrough that will make a difference. As I told people the other night, it's a little different. My brother's an orthopedic surgeon. He knows a lot of smart doctors, and he happens to have the head of the NCI and the head of the drugs part of the FDA looking in on his case, so he's getting pretty good support. But without these bridging functions that we're talking about now, we would have so much discovery, new ideas that never make it to the place they need to be. And without a clinical trial system that really works in this country, we're not going to know what to do with those technologies when they get there. So very excited about what the future has to offer. Let's all work together and make it happen. Thank you.